The current cancer landscape in the country can be characterized in terms of demand-side challenges, supply-side challenges, and the consequent outcome it has on the patient outcomes and the patient experience. On the demand side, the estimates are that in the current year, the cancer incidence is to the tune of about 19 to 20 lakhs, growing at a steep CAGR of 6 to 7%, which is pegged amongst the highest CAGRs when compared to countries like China, Indonesia, Brazil, and the UK. On the supply side, it is characterized by suboptimal penetration of comprehensive cancer care treatments in the country, with not more than 175 districts having access to comprehensive cancer care treatment, and more than 60% of the radiotherapy centers in the country located in urban areas which have only 30% of the population. All of this results in poor outcomes in terms of mortality to incidence ratio, which is considered to be the highest when compared to countries like China, UK and US across organs like head and neck, breast, cervical and GI. In addition to this, the challenge is further compounded by the low availability of information in terms of cancer registries providing data around incidence, mortality as well as survival, as cancer registries in the country cover only about 10% of the population. While India has its unique context and challenges, there can be some learnings which can be taken from global counterparts to guide the policy decisions for the country. For example, cervical cancer elimination by Australia, which has largely been driven by adoption of national level vaccination program, increase in screening coverage from about 13% to about 50% between 2002 to 2020 in South Korea. Given the rising population coupled with aging and intensification of risk factors, as well as the potential improvement in screening coverage going forward, cancer incidence is likely to grow at a rate of about 9 to 10% over the next 7 to 8 years. And if no intervention is undertaken, this will result in a demand-supply gap of medical as well as physical infrastructure to the tune of about 1.5 to 3 times. To address the dual challenge of increasing incidence as well as suboptimal mortality to incidence ratio, the primary response which the country needs to take definitely is large-scale awareness in terms of risk factors, symptoms, treatment and screening options, effective prevention by modifying exposure to risk factors like tobacco, alcohol, obesity and HPV, and at the same time taking measures to increase the uptake and penetration of screening. Following this, the key is to ensure right treatment to the patient the first time and at the last mile. And this can only be achieved by keeping the patient at the core